Today we have with us Dr. Madhuri Patel, who is the honorary at Wadia Maternity Hospital and past associate professor at Grant Medical College, Mumbai, and ex-professor from ESIS, Parel, Mumbai. She also currently holds the position of treasurer at FOGSI. She has also been the first assistant editor for the Journal of OB-GYN of India. She has over 22 years of teaching experience and has been a master trainer for HIV in pregnancy in Maharashtra. We would like to discuss on the topic scar ectopic pregnancy with Dr. Madhuri Patel. The first question that I would like to ask would be, Dr. Patel, scar ectopic pregnancy is a relatively novel phenomena. So, can you please explain us about what it is?
Per se, the ectopic pregnancy is one which occurs outside the uterine cavity. So we have been seeing the ectopic pregnancy in majority in the fallopian tubes and ovaries, corneal and abdominal pregnancy, etc. This is our past phenomenon. This was considered as ectopic pregnancy. But now with new event, new novel thing is coming up or new disease coming up is the scar ectopic pregnancy, where scar is most common during the cesarean section or any other surgery like DNC, hysterectomy, myomectomy. These are the scars in the uterus we have given, and it heals by the fibrosis. And if there is something called as microtubular tract remains inside, then instead of pregnancy getting embedded in the uterine cavity, it gets embedded in the myometrium. So this is about scar ectopic pregnancy.
Okay, ma'am. So, can you please explain about the prevalence and pathophysiology of scar ectopic pregnancy?
See, the prevalence at present, if we see, then it has been first diagnosed in 1978, and now the prevalence is about, or I will say incidence is about 1 in 1800 pregnancy or up to 1 in 2200 pregnancy. And it gives the incidence of scar ectopic pregnancy as 0.15% in previous cesarean section. As I have already explained what is a pathophysiology is that there is a microtubular tract in the myometrium following scar on the uterus due to cesarean section, DNC, myomectomy, hysterectomy, etc. So when the pregnancy gets implanted at the uterine cavity, it just passes through the microtubular tract into the myometrium, and it is completely covered by myometrium, and this is called as scar ectopic pregnancy.
So, are there any particular risk groups that show increased prevalence of scar ectopic pregnancy?
Yes, because nowadays the cesarean section is at rise. Then we are diagnosing certain uterine condition anomalies, myomectomies, that is myomas, they are also there. So we are more of we have not remained as a conservative as far as a myoma and anatomical defect of the uterus is remaining. We are doing more and more surgeries, and these are apart from cesarean section. These are the other reasons why we are saying more scar ectopic pregnancy.
So then what are the primary and secondary goals for the management of scar ectopic pregnancy?
The primary goal is that if this scar ectopic also, like other ectopic, can grow up to particular weeks of gestation. So when it is growing, it can protrude in the uterine cavity, and it gives the idea like this is a uterine pregnancy. It can go out of the myometrium towards the serosa, then it can form a mass. So the primary goal is that this ectopic pregnancy can rupture, and it can cause hemoperitoneum inside the peritoneum cavity where it is growing outside, or it can cause in the rupture of this ectopic pregnancy into the uterine cavity, then patient can have profuse bleeding. So the primary aim is to diagnose this condition, which is not that easy. Hence, we have to diagnose and treat the patient promptly.
So then, in your opinion, what are the best management strategies that can be adopted for scar ectopic pregnancy?
First, we have to diagnose. As I said, it is very difficult to diagnose. But if the patient comes with such symptoms, of course, the diagnosis becomes evident when it is a hemoperitoneum. But if she is having profuse bleeding, like sometimes the patient comes with missed abortion, sometimes the patient comes with early pregnancy for MTP, and when we are doing a curettage suction evacuation and we find suddenly patient is bleeding profusely, and you can't control, you try everything, medical treatment, everything, and then you realize this may be one of the scar ectopic pregnancy. So you may have to put a laparoscope at that time and see, because patient is already on the table, and see whether the ectopic is protruding out of the serosal surface. So the management is that if you diagnose before it ruptures, especially it is by sonography. Sometimes you can see empty uterus because there is pregnancy in the scar. Sometimes you can see protrusion at the serosal level. Okay, so these are the things you have to come to diagnosis. But there are differential diagnoses of this. Can be mistaken as missed abortion or inevitable abortion or a fibroid uterus or a cervical pregnancy. So you have to be careful about that, and you have to go according to the management part. But the sonography may give us a clue about the scar ectopic pregnancy. So the management now depends. If it is protruding inside the uterine cavity, you can suck it out, but it is very difficult to go into the myometrium. So the best thing is, first, if you diagnose before rupture, we can go for the medical line of treatment. How we are going for the other ectopic pregnancy, that we can use methotrexate and other drugs. But when it is a big enough, the mass is big enough, we have to do laparotomy, or if the expertise are present for the laparoscopy, then we can just take a incision at the scar where we are seeing the ectopic pregnancy, remove the pregnancy and suture it back. Similarly, per vaginum, when we are doing suction and you find difficult, there is no harm in doing a laparotomy anytime, and just take out the ectopic sac and suture the myometrium.
So then, according to your opinion, is the scar ectopic pregnancy manageable for its associated risks, and what would you recommend to the gynecologist? Are there any factors that they should look forward to while for the cases of scar ectopic pregnancy?
Yes, they should always look for it, because we always consider this is an intrauterine pregnancy and we feel that everything is okay. So whenever you find profuse bleeding when patient comes to you, or pain in abdomen due to hemoperitoneum, or the pregnancy is growing inside in the limited space, or whenever the patient, you are doing a DNC, you find profuse bleeding, you must think about this scar ectopic pregnancy, especially in the cases of previous LACs, myomectomy, and history of hysterectomy.
So lastly, we would like to ask that an online platform of 1,35,000 doctors like Docplexus, do you think it could help anyhow in the Indian healthcare, or support the doctors for discussions that happen on the platform?
Yes, of course it helps, because there are sometimes what happens, many of the doctors, we as an obstetrician, we are very, very busy practitioners. So sometimes, you feel that instead of reading, if I have to hear something, so this can be in a CD form, or this can be on the online or on the TV platform, whatever it is. Sometimes we just relax and see, okay, let me see something, and this can help the patient, obstetricians, and ultimately the patient to take care of this disease.
Thank you so much. Thank you for your valuable time. We are really glad that you shared your valuable opinions with us. Thank you.
Thank you very much.
These interviews and videos are brought exclusively for the members of Docplexus community. To stay updated about such upcoming events, we would request you to subscribe to our YouTube channel, like our Facebook page, and follow us on Twitter. Happy Docplexing!